How about cholesterol? This is worth looking at because the data is even more uniform than it is for high blood pressure. And I know there's still people going around saying that cholesterol isn't affected by your diet. Whoa. That amount of data, unless you're a hyper responder, that's what they say. Well, I'd say almost everyone is a hyper responder then. That is, when you stop eating animal products, okay, your cholesterol goes down. Now, it's a little more complicated than what I'm showing you here. It isn't just you cut back on the animal products and consuming cholesterol and your cholesterol drops. That's part of it, but that's not the whole story. It's very clear. The less animals you eat, the lower the cholesterol is going to be. Now, and I will get to the rest of that story, but I want to spend just a moment talking about inflammation for a moment, because there's good data out there that if you go on a plant-based diet, in this case, the Portfolio Diet, published 2003 in the Journal of American Medical Association from David Jenkins at University of Toronto, it was very clear that your LDL cholesterol would go down pretty much like a statin. Now, they use lovastatin 20 milligrams. That's kind of a weak statin. So you may not get that. You might get a better response from a full dose statin. Lovastatin is not as strong as rosuvastatin or atorvastatin, so-called Lipitor and Crestor. But the point was that both the statin and the plant-based diet would lower the LDL cholesterol and lower the high sensitivity C-reactive protein. And so you'll hear people, even on this conference, talk about the importance of inflammation, not just cholesterol, but what is your cholesterol, your LDL cholesterol components, how oxidized is it, but also how much inflammation do you have? And so if you look at the data from Paul Pritzker, where he didn't do a vegan intervention, he did a rosuvastatin or Crestor intervention, and the people who had the fall in C-reactive protein and the fall in LDL cholesterol, those are the ones who did by far the best. Now, this was reproduced more recently by Benita Shah, looking at the prospective trial, curiously or kindly, depending on how you look at it, published in the American Heart Association journal, saying that the American Heart Association diet does not work for lowering the inflammation. And so here is your C-reactive protein. When you do a several-week intervention with a completely plant-based diet, the C-reactive protein goes down about 30%, just like the Portfolio diet reported 20 years ago. The American Heart Association diet did not do that. Why? Because the American Heart Association diet, the old one before our newest guidelines, really talked about having fish and meat, lean meats. So lean meats are a good way to not get overweight really fast, but you're still, when you're consuming the carcass of a deceased animal, you are putting yourself at risk of everything that's in that carcass, and that is the hormones that were excreted into the bloodstream as the animal was being sacrificed, and everything that it touched after that. And it changes the bacterial content, which we're going to talk about a lot. But the important part is you're setting up an inflammatory condition, and that is always going to be the case.